Next, I'd like to introduce Ahluwalia, Director of the Department of Health and Human Services in Montgomery County, Maryland, who will give us an agency perspective and will talk about Maryland's experience in implementing affirmative non-discrimination policies in their foster care and adoption placements. So please welcome Uma.
Good afternoon, everyone. Maryland has been a very progressive state for a long time, and actually I called our state office. I said, I'm actually coming here presenting to folks, and I worked in Prince George's County, I worked in Montgomery County, I also worked in the city in DC, and the one really inalienable truth is that children belong in families. If at all possible, children deserve families, they have a right to be in families, they have to grow up in families. And our Secretary of the State, Secretary Brenda Donald, is very, very committed, particularly for youth, to experience families and to grow up in families and to have permanency be an inalienable part of their experience in child welfare, even if they are over 12, 13, 14, 15, 16, 17, 18 years old. Children need to know that they belong somewhere. And that's really been a big driver for all of us in terms of our thinking. In Maryland, there is an initiative called Place Matters, which is really about finding appropriate families for children in foster care. And in Montgomery County, we have been very, very aligned with the state goals of placing children in families. And our courts are very progressive, and that's one thing I would say. A lot of this depends on your courts. It depends on the social workers. It also depends on the court system as to how receptive they are to placing their children in unique families. We have, for a long time, been very open to all manner of families, single-parent households, same-sex parents, different family structures in Montgomery County, fostering adopted children in our community. We have many children. As the numbers of adolescent children in our system is growing, there are many children who are coming in who also have lots of gender identity questions and sexual orientation issues that are largely unresolved, actually. One of the things we find is sometimes when children are placed in families that are better able to meet their needs, a lot of their issues, their confusion, their identity issues get resolved much more easily when there are supportive parents at home. To that extent, I think all of our social workers, our staff, are trained to be receptive to the experiences and the willingness, really, to place children in families that best meet their needs. And I think the best interest of the child has to be the single most important driver. Too often, from the story, if there is not a match between the child and the parents, then the experiences tend to be bad, both for the child and often for the parents too, because they are looking for something different from that experience. So there's a lot that goes into matching children and placing them in their homes. On one particular story I wanted to mention, there was a couple, same-sex couple, who actually adopted a school-age boy who was very severely abused by his father. The child was malnourished at the age of 7. He was the size of a 4-year-old. He was diagnosed with post-traumatic stress, attention deficit, learning disability, and even though several mental health professionals recommended that he consider it for medication, his psychiatrist said he would evaluate him and see how he did in this particular home. And the child made such strides, he made such gains out of that experience in a loving, nurturing family. He's done so well. There has not been a need for psychotropic medication. It has been really one of those, he's grown, he's gained weight, and he's been happily adopted by his family. And it's been one of those stories that really points to the fact, not so much to the differences, but the fact that a loving, nurturing family can make a big difference in the lives of children. I'd say that fostering family connections and ties have been very, very important for youth transitioning out. One of the facts that we know is when children age out of foster care, the first place they go back to is their families. And if they don't have connections, then they really are very lost. And there is an obligation really in every system as children are, as they are in foster care, to build those relationships, to build those connections. And having families, any manner of families who are willing to foster, adopt our youth, who are dealing with very challenging issues in their adolescence, is really very, very important. One of the things we found is that children who have sexual orientation or gender confusion issues experience some form of rejection in their adolescence as they're growing up in school or in other types of settings, and having parents who understand those issues and are being supportive really helps ease those transitions. Our commitment, again, as I said, is that we're able to find a family who can meet the needs of children, support them to become healthy, well-adjusted adults. The children who are successful in maintaining relationships really benefit from the stable social structure. And Montgomery County's foster youth population is a distinct advantage that a very high percentage of our youth actually graduate from school or obtain their GED. And that decreases the risk of living in joblessness or experiencing homelessness, becoming incarcerated or early parenthood. And we're trying really hard to try to see if health and mental health benefits can extend past the age of 21, which is how long children can stay in foster care in the state of Maryland. So, if the children don't have good family supports, then you do have poorer educational outcomes, and the lack of family supports do lead to other adverse effects that we talked about. In Maryland, there is no prohibition. If this bill were to pass at the federal level, there are no statutes or laws currently in the state that would prohibit the implementation of the statutes, and we would be very supportive if we went forward. So I'll stop at that. Thank you.